director for at the Center for Accessible Living. And so you'll get to learn about all this, as well as we're going to look at the different work incentives that are available for people with disabilities. And I think I understand that most of you are working with people with disabilities, or you may have a disability yourself and receiving a Social Security benefit. So this information should be valuable to you as well. So we shall get started. Let's jump in. And I think I share and hit this PowerPoint. If you have any questions going along, if you can, Fox and maybe Joey can help me monitor that to make sure that, you know, I can stop, because I may not see it. And if I, you know, if you need to stop me, because once I get talking, I keep going. So we shall start from the beginning here. Can you all see the screen? Yes?
Yes.
Yes. All right, good to know. So, and normally speaking, if you place yourself on mute before you begin, that's helpful in case, and I apologize up front, if the UPS man comes, my dog will bark, and we are all remote, and I have to leave my microphone on because I'm talking. And then also, this is fairly long, so if we need a little break in the middle, we'll go ahead and stop for a second. So, you know, if you need a short break, we'll do that. My contact information, this will be on the slide presentation that Joey sends to you. So if you have additional questions or a specific client in mind or something that you kind of want to process through, here's my direct office line. It's 812-389-1050. Like I said, we're all working remotely, and so this is my direct line. I live rural, and so cell service is not always the best thing for me, so I have a direct landline. You can also email me at dmundy@calki.org. And like I said before, I'm Donna Mundy. I'm a certified work incentive counselor, and I've been a work incentive counselor for over 10 years. So I've been doing this a long time. So the Work Incentive Planning and Assistance Program is based at the Center for Accessible Living. I've included this information, so you have this contact information as well. Today's objectives, we're going to look at the two main types of Social Security benefits for people with disability. These are the two that you're likely going to run into. And then also a short overview of the tools or the work incentives that are available to people who are receiving a disability benefit, and then also what happens when they try to go to work, because information is key. And then we'll, at the end of the program, or at the end of the presentation, we'll talk a little bit about what this Work Incentive Planning and Assistance Program is, or you may hear it called WIPA, if people refer to the WIPA. So I'll let you know what that is all about and how you can get help. The first work incentive that we're going to talk about is supplemental security income. So just think of it as putting on your SSI hat. These are people who just receive supplemental security income. And so by the end of this section, hopefully you'll understand what happens to your SSI cash benefit if you have a job and are receiving earnings, and basically a paycheck. We're not going to cover self-employment in this because that's a whole different animal, We'll look at 4 of the most commonly used SSI work incentives and how they can be used to reduce countable income. And then also a very special benefit called 1619B. So what is supplemental security income? And it's commonly referred to, people say I have SSI. So it's a cash benefit for people who are age 65 or someone who has a disability or is blind, and they have very limited income and very few resources. And normally those resources, if you have more than $2,000 in resources, you're considered to have too many resources. It's paid for out of Social Security Administration. So when people say, yeah, I get Social Security, you have to find out which type of benefit it is. And in Kentucky, SSI recipients are automatically eligible for Medicaid. So that's a good thing to remember. If they get SSI, Medicaid, that's tied to their type of health insurance. In 2021, SSI payments are capped at $794. And SSI recipients are normally people, they may be young, age 18, 19, they haven't had a work history, so they haven't paid into the system, or they've had very limited work history, and so they haven't acquired many resources or things like that. Those are the type of people who normally are receiving SSI. They are needs-based, and so that means any kind of income will have an effect on their SSI cash payment. And income can be considered anything that an individual receives in cash or even in kind. They call it in-kind support and maintenance that may be used to help them meet his or her shelter or food, what they need to get by on each month. And this can also include unearned income. So some SSI beneficiaries may also receive an SSDI benefit, and we'll talk about that a little bit later, but it means they have had some work history, but maybe their SSDI benefit is kind of small. Or they may receive some type of payment, an annuity or something else that's considered unearned. And then there's also wages or earned income, again, deemed income, or in kind. So I've kind of jumped ahead here, but earned income is wages. It could be earnings from self-employment. It could be royalties. I've actually had clients who have written books and were receiving a small royalty payment off their book, and even sheltered workshop payments. There's not as many of those as there used to be, but they still exist. Again, the unearned income could be Social Security disability. It could be a pension. It could be a state supplement payment, as well as unemployment, interest income, or dividends. In kind is food or shelter. Deemed income could be the income of the person's parents or a spouse that they're living with, and that person is not receiving a disability benefit and they're working, and so part of that person's income is counted to the care and welfare of the person receiving SSI. Like they're assuming if you're married, you're living in the same house with your spouse, they're helping provide your food and shelter. You're not going to be paying rent. Okay, any questions on this stuff so far? You'll have to wave. All right, so how is income counted for SSI? The good news is Social Security doesn't count all the income that a person receives when they have an SSI cash benefit. There are exclusions that they apply. And so these are what we'll go over in the next few slides. The basic exclusions is first, it's a $20 general income exclusion. It's like you have any income, they'll subtract $20 off. If you're working, they'll apply an earned income exclusion of $65. And I'll show you the formulas and how this works out as we're going forward. And then they count $1 basically for every $2 of earnings after that, or basically after they subtract the exclusions, they'll divide by 2, and that's what they're going to count. And because of these exclusions, SSI recipients always, always, always have more money when they're working than when they're not working. Because remember, SSI is capped at $794 a month. So basically, you start with your gross monthly earnings, you subtract the $20, and then if they receive any unearned income, and in the materials that Joey will send with you, I've got some blank charts that you can use that you can follow along when you're working with people, an actual calculation chart to fill in the blanks. But if they're receiving an unearned income like an SSDI benefit, the $20 would come off of that instead. Then down through the earnings, they'll subtract the 65 and again divide by 2, and what you're left with is the countable earned income. So they'll add together the countable unearned income if there is any, and then the countable earned income, and then they'll subtract that from the base SSI rate, in which, remember, in 2021 it's $794, and the remaining amount is what the new SSI cash benefit will be. So here's an example. So John is going to work and he's earning $623.50 per month. So they're going to subtract the minus $20 because he doesn't have, I'm going to move my face here. He's going to subtract the $20 because he doesn't have any unearned income. Then they're going to subtract the $65 and then they're going to divide that remainder by 2. So it's really quite simple. So that means Social Security is only going to count $269.25 of the $623.50 that John is earning. So they take the $794 minus what Social Security is counting, and that means the new SSI cash payment will be $524.75. But if you add the $524.75 together with their wages, the $623.50, the monthly gross income is $1,148.25. So you can see when you're working and you're on SSI, you always have more money in the house. Always, always, always. Okay. So one of the important things to remember when you're receiving SSI is it's very important for Social Security beneficiaries to report every single month. They will report when they first get the job, say, I've got this job, I'm going to start on this date, I'm going to make this, make this much per hour, and I'm going to work this many hours a week. They let Social Security know. Social Security says, okay, send us your pay stubs. And so each month before the 6th or the 10th of the month, depending on your reporting method, you have to let Social Security how much you earned that month. And when you're receiving SSI, Social Security counts when you get paid. So the important thing to know is if you get paid every Friday and there's 5 Fridays in the month, your SSI cash benefit might be smaller the following month because you had 5. Because remember, it's supplemental. So they want to know about how much income you have that month. And so your SSI payments go up or down based on how much income you receive in a month. And generally there's about a 2-month lag time. So by the time that it gets there, but the importance of reporting is so that, that you don't get caught up in any kind of overpayment situation. So there's more good news. In addition to these basic calculations that they use on everybody, there's several other work incentives or deductions that you can use to reduce countable income even more. And so these work incentives allow the SSI person to keep more of their money while they're working. And this helps them ease from, helps build that financial stability, that ground level. So as you're working your way along, okay, I know what's coming. I know what tools I can use, and it helps you remain more financially stable. These are the work incentives most commonly used. It's the student earned income exclusion, and we'll go through each of these separately. Impairment-related work expenses, blind work expenses, and the PASS plan, or the plan to achieve self-support. I'll try to give you examples as we go along here. So the student earned income exclusion applies to someone who is under age 22 and regularly attending school. So if you're working with any beneficiary, or if you are a beneficiary who is under the age of 22 and you have any thoughts of going to school, this is the time to do it, because after you reach age 22, after you're over 22, this work incentive no longer applies. But the great news is Social Security excludes up to $1,930 each month. That's the amount for 2021. They'll exclude that much of your earnings right off the bat. And the yearly limit is $7,770. And so normally if you're in school, you may be in the spring semester, the fall semester, you might work all summer, but you're not in school. But so it balances out, but up to $1,930 a month. And like I said, they apply this before any other exclusion. So it's an awesome work incentive. So with this work incentive, students can work and keep their earnings. They won't count until they surpass that monthly limit or the annual limit. And this goes up a little bit every year. So here's an example. Beth is a 19-year-old student and she's still attending high school, but she is working in a part-time job. So, and she's earning $1,247 per month. So she's getting her paycheck of $1,247. Well, because the earned income limit is $1,930, they deduct the entire amount. So her countable income is zero. So they take the base SSI rate of 794, subtract the zero that they're counting. And so she keeps her entire SSI cash benefit of 794 plus her earnings for a total of $2,041 per month. So she can really build some financial stability with that. Impairment-related work expenses is the next one that we'll cover, and that's called IRWEs. People might ask you, do you have any IRWEs? And that's what it is, an impairment-related work expense. And the purpose of this work incentive is to help SSI recipients recover some of the cost of their expenses, because of their disability and their ability to work. And so it deducts the cost of the impairment related items and the services from the monthly gross wages. And you'll see where it falls in the formula that it's after the divide two or before the divide by two. So it's really half of their expenses. So they're able to recoup half of what they're paying out in order to work anyway. So what kind of criteria meets an IRWE? The items must be directly related to work. You must need the item or service for work, and due to your disability or disabling condition, the cost may be paid by the individual. They must be paid, not like OVR is paying for something or someone else is covering DCBS. It must directly be paid by you. And the expenses normally must be paid in the month in which the individual is working. There are some exceptions. For example, if you have a motorized chair and you have a modified van and those modifications need repairs, that repair, or even maintenance, and that will last for 6 months until the next time. Social Security often will divide that over the course of 6 months, but these must be discussed up front with Social Security. Sometimes, or if someone needs a special brace or a special thing due to their disability and they're working, and that lasts, a period of 12 months, or it needs to be replaced every 6 months, they'll divide that up. And of course, the expense must be reasonable. These are some examples of impairments. Certain transportation costs travel to and from work. For example, if you have a seizure disorder and you are not allowed to drive and there is no public transportation available, so you are paying a family member a reasonable cost or an Uber, these costs can possibly be deducted as IRWEs. I had a client who could take public transportation to her job on a college campus, but the public transportation quit running at 6 p.m. She worked at this facility until 8. So that meant she had to hire someone to bring her home. And so Social Security deducted that as an impairment related work expense. Attendant care, and these could be someone who's helping you get ready for work, or in the morning if you require that. Costs associated with service animals. This can even be the training of your service animal before you even have it, but that's coming up, that it has to be trained in a specific way to assist you. Those are things that you want to save your receipts for and document so that they can be used as IRWEs. Again, medical devices, prostheses, prescription drugs is a good one, because sometimes now if you have to take blood pressure medicine, that's a prescription that enables you to live. But say you have mental health issues and you are working and now you're taking an additional type of medicine, And, you know, because it helps you work, those are costs that you can turn in and use as IRWEs, and certain diagnostic procedures too. So here's an example of an IRWE. It's John again, and he's receiving that $623.50. So we know how we did that before. We minus the 20, we minus the 65, we divide it by 2, and that left us with the 269.25. Now, John has determined that he's got $150 in IRWEs each month that he could potentially apply, you know, that he has to get approved by Social Security. Well, now you take the minus 20, minus 65, the remainder is $538.50, then you subtract out the 150, and that leaves him with $388.50 to divide by 2. So basically, Social Security is going to deduct $75, or half of that $150. But it reduces his countable income to $194.25, and that increases his SSI cash benefit to $599.75. So it helps him recoup some of the expenses that he's incurring related to his disability with him working. Blind work expenses. Now, these are called BWEs, or blind work expenses. These are available only to SSI recipients who are receiving cash benefits because they have statutory blindness on their record at Social Security. So that's often a question. We work with people who have blindness or limited vision. And that's one thing we always have to check. Does Social Security have you listed as statutory blind? And sometimes it is not on the record. And that means that this person could not use a blind work expense. So that's something that you want to check on, because there are some people who have been blind their entire life and they're not listed as having blindness on their record at Social Security. And so that's a process to make sure that's added. But the blind work expense allows you to exclude any work-related items that are paid out of pocket and not reimbursed. These expenses do not need to be related to any impairment. They only need to be expenses related to working. And this work incentive is only available in the SSI program. It's a phenomenal one. Here's some examples. So service animal expenses, this could be your dog food, your vet bills, training expenses, anything related to your service animal if you have a service animal, transportation to and from work, the taxes that they take out of your check, union dues, any of those type of things that you can actually turn in as a blind work expense, and that ups your SSI cash benefit. The following shows an example. So for example, Carol is blind. That means she's statutorily blind according to Social Security's definition, and she earns $723 per month. So with the general exclusions, minus 20, minus 65, divide by 2, her countable income is $319. Well, going through her work experience, she discovers that she has $250 worth of work expenses. So she's going to turn those in as BWEs, and that's deducted from the $319. Remember, it's subtract minus 20, minus 65, divide by 2. Now they're going to subtract the blind work expenses, and that leaves her with $69 of countable income. So the $794 minus her now $69, she still gets to keep $725 of her SSI cash benefit along with her earnings. And she doesn't have to pay, she gets reimbursed basically for all those expenses that are taken out of pocket. So it's a great work incentive. Now the PASS plan is called the Plan to Achieve Self-Support. This is a work incentive that allows a person to set aside a portion of unearned income or their earnings or resources for a specific period of time in order to pursue a work goal and to help pay for these expenses related to achieving this goal. We'll talk about some examples, but with a PASS plan, Social Security does not count any of the income that's set aside under the PASS plan when they figure out what the new SSI cash benefit is. They also do not count the resources, because remember with SSI, there's a $2,000 resource limit. So if you're saving long-term for an employment goal, you could have more than $2,000 in your PASS account, and that could potentially throw you out of SSI and Medicaid if it's not designated as a PASS plan. So what are some PASS expenses or money that are things that you might want to save for? Well, obviously education or training. I have a PASS plan person who's working on his master's in divinity. As you know, there's often help, Pell grants, different kinds of grants for associate's or bachelor's degrees. But when you get to the master's level, unless you can get a scholarship, there's not often a lot of help with that. And so setting up a PASS plan to help pay for master's expenses can be a way to go. And also if there's job coaching or other support, that after a certain period of time that you're going to need assistance, you can put money aside to help pay for those. Transportation, I've had a couple of people save for automobiles so that they know as their goal is to get their license, then that they know that they're eventually going to need an automobile because they live too far out to utilize a public transportation system, and that it's their goal to be able to drive to work. Any job-related items, like it could be mechanics needing their tools or things like that, even equipment that you need to start a business. The basic PASS requirements is you must have a feasible and very specific occupational goal. So Social Security wants to know specifically, what do you plan to do? Now, like my guy who's working on getting his master's in divinity, his specific goal is to work in a parish doing youth ministry, and having this master's in divinity is relevant to this goal that he has. So that's why it's important for him to save money and to be able to get this qualifications. Often jobs like a master's in social work is often required for other positions. And so those are ways to save for that. They also have to go through and identify all the expenses necessary to achieve the goal. And I find if you break it into sections, it's not so big. You just kind of think through step one, okay, this is what I'll need. I'll need this. For example, buying, I need a car. Well, how much is driver's training? How much is this going to cost me, for an average car? What would my monthly payments be for the car that I need? What about my car insurance? What about plates and expenses? Registration fees, those kind of things. So it's looking at all the pieces that you will need to get to that goal. And like I said, if you break it down, it's not as big as it looks like. And you also have to have an earnings goal that will decrease your dependence on public benefits. In other words, if it's your plan to go out and get a vehicle, but you have no intention of working your way off of benefits, Social Security will likely not approve that goal. They want to see that you are going to be working in a situation that is going to help decrease your dependence on public benefits. Step 4 is to identify the steps and milestones for progress toward the goal. Okay, so like using the car as an example, buying a car. Step 1, sign up for driver's training. Step 2, get your driver's license. These are the steps that you can see. Save enough for a down payment, purchase the car. You can see what you need to do. You have to have a definable time frame of when the PASS begins and ends. In other words, it can't go on forever. You can't say, well, I want to keep putting this money in this PASS plan to pay my car insurance till the end of time. There's going to be a time when you say, okay, because now I have this car, I've made it this far, I have this job that supports me. At this point of time, when I get everything paid off, I'm on my own, I'm good. And then you also have to be able to find the income that you're going to set aside. And that means if it's unearned income, that could be an SSDI cash benefit, or it could be a portion of your earnings. And there's an example coming up. And then there's a form called SSA 545. It's about 17 pages that you complete and you turn into your local Social Security office, and they'll send it on to the PASS cadre, which covers a large territory. And in Kentucky, that's usually out of Atlanta. And that cadre person is the one who will approve or deny the PASS plan. And after it's approved, they will work with the person on completing their steps and making sure that all the paperwork's turned in and those things. So they're really helpful. Here's an example of a PASS. So Tia is working, she's taking a, planning to take a mechanics training program, and she's working part-time, but she needs to buy tools in order to complete this program. That's part of the requirements. So if she just is working, she's getting $800, again, minus the 20, minus the 65, divide by 2. Her countable income is $357.50. They'll subtract that from the $794, so her SSI does reduce to $436.50. Now, if she decides she's going to take $357.50 and put it in a PASS plan, we'll see the difference. So it's the 800 minus 20 minus 65 divided by 2. Now the PASS calculation comes after the divide by 2. And so she's taking the $357.50 of her countable earnings, using that entire thing to fund her PASS, which makes her countable income 0. So the 794 minus 0 is still 794. So she's able to build her savings and her work towards her employment goal with that PASS plan fairly quickly. All right. We also talked at the very beginning about Medicaid protections for working SSI recipients, and I told you about 1619B. 1619B is a very special work incentives because it helps protect an individual's Medicaid. And as we know, health insurance coverage is often very high or unattainable. So having Medicaid often for a lot of people is literally life or death. And so keeping their Medicaid coverage is super important. Well, with 1619B, it's a protection. So if your SSI, if your earnings become too high, that when you do the minus 20, minus 65, divide by 2, your SSI payment is 0, you still get to keep your SSI and your Medicaid because of 1619B. Now there's an earned income limit. We'll get to that here. But the good thing about 1619B, it also protects your SSI status. Because you know I said as you're working, your SSI goes like this. It goes up and down based on how much money you have in your house. So if your income gets so high that your SSI is 0, well, you still stay on the SSI rolls. They're not going to cut you off immediately because of the 1619B. They see that you're still utilizing it. So to meet the 1619B eligibility requirements, you must still be blind or have your disability. You must meet all the SSI eligibility requirements, meaning like you don't have more than $2,000 in resources. And your earnings have to stay under, in Kentucky, it's $32,062 annually. So that means as that's going up or down, what's your eligibility for the whole year, often people even working full-time can still manage their Medicaid in order to keep their Medicaid through 1619B. And also there's a criteria that if you have to have been eligible for Medicaid or SSI at least 1 month before becoming eligible for 1619B. And you need your Medicaid in order to work. In other words, you're using your health insurance. So how do you get help with SSI and work incentives? Because each person's situation is unique and different. You may need individual work incentive counseling. You may be able to help your person so far along. You say, "Oh, I'm not sure about this. Let me get some help." Well, that's what the WIPA is for. We're available to help. So you can start by contacting us, your local WIPA project, and we get you started. On this slide, I've put the Social Security's ticket to work line, and that's the 800 number that if, regardless of where you are in the state of Kentucky or where you are in the United States, you can call this number and they will put you in touch with a WIPA, with us through the WIPA, Certified Work Incentive Counselor will call you and talk to you. They'll say, so-and-so will be calling you. And that means wherever you are, if you're in Eastern Kentucky or Western Kentucky, in Jefferson County, they'll hook you up with the right WIPA to serve you. So this is the time that you're going to take off your SSI hat. Does anybody have any questions about SSI? I don't know if there's anything in the chat box, Joey, or if anybody has any questions, just unmute. No questions. Thank you. All right. So now you're going to take off the SSI hat and put on the Title II hat, or what often is referred to as SSDI. So different set of work incentives and different set of how working is going to impact that benefit. One of the, here's the objectives. One of the key details is we're going to talk about substantial gainful activity, or SGA, and what Social Security considers when making SGA determinations, and also the work incentives that you can use if you're receiving a Title II disability benefit. There's different types of Title II disability benefits. The one I mentioned was SSDI. That's Social Security Disability Insurance. And that means you've had a work history. You've worked enough quarters that you've paid in your Social Security taxes. And now this is your insurance. This is a benefit that you have that can come back to you. And so that's SSDI. The other types are Childhood Disability Benefit, or CDB. Sometimes that's referred to as DAC, which means Disabled Adult Child, but Social Security refers to it as CDB. And then DWB stands for Disabled Widow Benefit. Okay. Childhood disability benefit is something that you could potentially receive if you have your disability since you were a child before the age of 26, and now your parent is on disability or receiving a Social Security retirement benefit. That may make you eligible for a CDB benefit. Now, a disabled widow benefit is someone who is age 50 and their spouse has passed away. They may be eligible on their spouse's benefit to receive that widow benefit because of their disability at age 50. I always ask, when you're talking to your clients, you ask single, married, divorced, widowed, to find out where the person is. Even if it's someone who's divorced and they were married to that person for more than 10 years, they could be potentially eligible for the disabled widow benefit at age 50 if that ex-spouse has passed away and they were married for more than 10 years. And for some people, that can make a big difference in their benefit amount, and which increases their financial stability. Like I said before, it's a form of insurance. You've paid your taxes in, or your parents or someone has paid in, and now this is the insurance coming back. It is not means tested. So that means there's no, it doesn't matter whether you have 2 homes or if you have $1 million in the bank. Social Security does not care about that. What they're going to look at with this type of benefit is your ability to earn. So you can have resources way more than $2,000, and you can have other forms of unearned income. So that's like recently with the COVID and the unemployment, there were a lot of people getting unemployment benefit, and they had deep concerns about what's this going to do to my disability benefit. Well, if they were receiving SSDI, it wasn't a problem at all, because it's not, they didn't earn that unemployment. So the amount that you receive in a disability benefit is determined by your record and how much you've worked, how much you've earned over in the quarter. So it can vary greatly. Someone could get a very small amount of, $300 a month, or they could get, on a max end of $1,500 or $1,800 a month, really depending on their work history. If you sign up to that My Social Security website, you can actually see what your disability benefit would be. Years ago, they used to send you letters every so often to let you know how many quarters you had and how much your disability benefit would be or how much your retirement benefit would be based on the information they had. Well, you can now get that on the mysocialsecurity.gov. So the first concept we're going to look at is SGA and the relevance of SGA, because a lot of people will call in and they'll say, how much can I earn? How much can I earn? And it's important to know that substantial gainful activity, or that SGA, is a decision, and it's not necessarily just that number. So it is an assessment of the value of the person's work effort. So this person may actually be putting a lot of effort into work and not actually getting paid as much, or they're actually getting paid a little more than what a counterpart might be. So SGA always requires judgment and interpretation. They're not always black and white, and generally they're not made in real time. And Social Security will kind of look at a period to see if the person is doing substantial gainful activity. Are they working enough that it looks like substantial gainful activity, or that means you're able. What was that comment, please? I just saw it briefly and then it went away.
Oh, can you hear me okay?
Yes.
So I'm not sure if it's true or not, but we see a lot of clients for SSI and Social Security. I work with LIHEAP, so we have a lot of people coming to get help with their utilities.
Yes.
But I don't know if it's true or not, but I've had some clients say that if it's a minor, like they don't have access to like a My Social Security for some reason, like they can't get their letters off of it. I don't know if it's true. I've had a couple tell me that. Does that sound like anything you've heard of?
I've heard it both ways. I've heard people say they have no problem pulling the letters off of the My Social Security account, and I've had others say they have difficulty pulling it off. So I can't say one way or the other, because I do have clients too, because we have the CARES Act funding. So we have people trying to pull letters, to verify their Social Security amount. They can also call the 800 number and have a letter sent, but I know this stuff takes time.
Yeah, that's normally our rush too.
Yep, and with the offices close to in person, that can also, be an issue. So I've heard it both ways. I can't say it for sure it always works, but I have had clients say, oh yeah, that was real easy. I pulled it right off.
Yeah, I was just curious because I heard about the minor side. I didn't know if you maybe had experience with that part.
Oh, I haven't. All right, good question.
Thanks.
All right, only Social Security can make these SGA determinations. So you yourself can't say, well, I don't think they're working SGA. Social Security will be the final say so. And it's our job to make sure that we provide the beneficiary with enough information that they can make a good case for Social Security to say, this is how it works. All right. Again, that amount is set against a value of how work is compared. This is that dollar amount that people are always calling about asking for. So the SGA guideline for 2021 is $1,310 per month for disabled individuals, and it's $2,190 for people who are blind. So the work performed in that year is compared to the SGA guideline for that year. So if someone is working over, Social Security is looking at the year, but they started working in 2020. The SGA guideline in 2020 was 1,290. So they have to make sure they were under SGA at that time or not over SGA, depending on what they're looking at. They'll look at a course of time to make the SGA determination. So a pattern of work that's always above that annual guideline is likely going to be SGA, obviously. And if it's consistently under, then it's likely going to be considered not SGA, and their person's cash benefits can continue. The one thing about Title II benefits that you want to keep in mind, it's the all or nothing. Remember, SSI is, I get the more I earn, my cash benefit goes down, but if I earn less, my cash benefit goes back up. Well, with Title II benefits, you either get all of your benefit or none of your benefit. So being financially prepared and alert about what's coming down the road is super important. So, like I said, if you're consistently under Social Security, like let's say they're under, and they do look at the years because they want to make sure that they're evaluating the situation fairly. So, what are factors that they consider? They're really going to look at how long the beneficiary is able to maintain the SGA level work, and what is going to count as earnings. So they're going to look at a couple of different work incentives to say, well, how much is this going to count toward their earnings? So they're going to use specifically two different work incentives, which is subsidies and special conditions, and excuse me, impairment related work expenses again, when they're making their determination. So subsidy and special conditions, and I'll use some examples here. So the individual's wages, they may have this amount of money that they're receiving, but maybe they get help from someone, or they're not producing at the same rate as someone else who does not have a disability. So here's an example. I had a client who was in a motorcycle accident, and he was hospitalized for quite a while, but he went back to his job as a mechanic. Okay. He had worked there for 14 years prior, was a good employee, and they loved him and they couldn't wait for him to come back. So as he recovered and he went back, well, as a mechanic, and with those shops, they know this is how long it takes to do an oil change. This is how long it takes to change out tires or to do this other repair. Well, this guy, when he first started back, he was only at 75%. It took him longer to change the oil or to do some of the other ones. And the employer could note that and say, well, he's at 75% right now, or he's at, and as he continued to work, he was able to do more and more to reach, full capacity. So he could adjust his subsidy as he was going along. I also had a girl who was doing dishes at the Brown in Louisville, and she was a great worker, loved her job, was pleasant on the job, never missed a day, was always there. But they know that, okay, for a person without a disability, it takes this long to do this stack of dishes. But she was only about 85% capacity. And no matter how long, she got better as she went along, but she really was still only about 85% capacity. So the HR department at the Brown could write a letter and saying, she's a great employee, but she's not working at the same level as a non-disabled employee, as someone else doing the same stack of dishes. So those are things that you can look at. I had a girl who was a social worker, and one of her subsidies or special conditions was it took her longer to enter case notes. So her employer gave her less cases than another case because it took her longer to enter all the notes, and gave her a few extra hours. Like they entered all case notes on Thursday. And so on that Thursday, she just got a few more hours than her other coworkers. So those are things that you want to look for to say, do any special conditions or subsidies exist? And it's not only even that assistance on the job. It could be, sometimes there's evidence of subsidies or conditions because maybe they're purchasing equipment for the individual or that kind of thing. So you just want to keep your eyes open. So if those earnings don't accurately reflect the true value of the person's work effort, then Social Security then looks at it a different way. So they can say, okay, this is, her earnings. They can dock that, take that 15% off, and that can be a big difference in the end. So, and then did I skip early or is coming? Okay, during that, like I said, they do look at the ability of the individual to perform the substantial work and not just the earnings. And so we've talked about some subsidy or special conditions that could result in more pay being received than the actual value of the services performed. So they will look at the value of the subsidy and the value of the extra help. One of extra help that a person might be receiving is I had a client who did accounts payable for a firm. And so she would pay all the bills, and then at the end, of each day, she had to save all the original invoices and all that thing. So they had to be filed in a file cabinet. Well, because she was in a wheelchair, she couldn't get to the top of the file cabinet. So rather than the employer replacing all those fireproof, expensive file cabinets, they just had another coworker help her file the top drawer of the file cabinet at the end of the day. And so that's really paying attention, because it was like, oh yeah, she helps her, every day, it might be 15 minutes a day. And 15 minutes a day over the course of a month can add up, what that portions of the wages are. And you can show how you can document that. And that's an extra help when reporting subsidies to Social Security. So these impairment related work expenses. Now these are exactly the same as what an SSI recipient would use, except Social Security will allow you to deduct those costs from your countable earnings for SSDI. So that still allows you to earn more than SGA guidelines and still retain your cash payments. So I had a person who was working full-time in the mall. She managed one of those little kiosks in the middle of the mall, but because she had a mental health issue, and in order to keep this full-time position to manage the store, she saw her therapist an extra time per month, which she paid out of pocket $60 for. And then also they adjusted her meds a bit. And so by saving her receipts for those expenses, she would turn those into Social Security, and that allowed her to reduce her countable earnings to the point that she could still retain her full SSDI benefit. Not everybody has enough impairment-related work expenses or subsidies to make a difference. But for some people, if you're earning, $1,400, it's really important to look into impairment-related and subsidies, because you're so close to that SGA determination. And you don't want that little bit to know that you can lose. Say you have a cash benefit of $800, that total $800 could go away, when all you got to do is do a little investigating to see if any impairment related work expenses or subsidies exist. Remember, it's the all or nothing. Again, the impairment related work expenses, I won't go through this because it's the same list. And Social Security definitely makes the determination about whether they'll consider that an IRWE. It's very important to write it out, provide a documentation in writing why you feel that's an IRWE, as well as the listing of the expenses. I did have a Social Security office in Louisville utilize mileage for somebody as an IRWE, an impairment related work expense, because this individual had to drive to different locations, accessible locations in the city as part of her job, because this social worker could not get into the homes of the clients like the other social workers would do, because she was in a motorized chair, so it wasn't feasible in every home. But so she might have to drive to a specific library or a different setting other than her office, where she was closer in the neighborhood where the client lived. And Social Security, because she was not reimbursed by her employer, Social Security actually helped her document that to show that that could be an IRWE. So I urge you to, think out of the box and, help the person determine what they might have. Some other tools Social Security might use to determine SGA level work is, like I said earlier, they really look at it over a period of time. So if that work attempt is no more than 6 months, then Social Security going to say, I don't think that, I think that was an unsuccessful work attempt. They've only were able to do it for 4 months. They're not able to maintain it. So an SGA determination they would say, no, they're not able to maintain and, their SGA level work. I had one person that was working for so long, but after the removal of transportation, they could no longer get to the position. And there was really nothing, that was a big barrier. And so they couldn't maintain that level. They couldn't maintain the job or that employment. So, and Social Security also will look at if your income averages, like if it goes up and down, and what they're going to look for is a consistent pattern of work. So if you're consistently working at a higher level above SGA, they're going to determine it to be SGA. If it's consistently under, they'll say they're able to work, but not quite at SGA. So normally they're not going to use averaging. It's only applicable at certain times and normally after the extended period of eligibility, and we're going to talk about that next. And the policies are very complex, and again, only Social Security is going to make that determination. So some of the common fears about Title II cash benefits and working. Some people feel that if they engage in SGA, their benefits are going to stop right away. That's absolutely not true in most cases. And also, if they try to work at substantial level and they think, I'm trying it, I think I might be able to do it, but what happens if I can't? Well, there's good news because there are work incentives that help a person either stay on their benefits or get them back right away at a fairly fast pace, that they can get them back right away. And also health insurance. Many people are deeply concerned that they'll lose their Medicare. Good news, there's work incentives that help you keep your Medicare and your health insurance. So here are the work incentives that allow a beneficiary to test their ability to work. And we call, there's phases, which is the trial work period, the extended period of eligibility, and then post-EPE. But there's also that SGA decision and another work incentive called cessation and grace, and as well as the extended period of Medicare protection. So we're going to break these down. So during trial work period, no other work incentives apply. All your earnings count. So what Social Security is going to do, you're going to tell them everything that you're earning. This is the time to really get out there and say, see what I can do, because no other work incentives apply. And it doesn't matter how much you earn, you're still going to get your SSDI cash benefit if you have not used trial work period in the past, because there's only one trial work period per period of entitlement. And what Social Security is going to do is they're going to count your trial work periods in a window of 5 years. So they're going to look at 5 years. So you don't have to use them in a row. Some people think, oh, once I start working in trial work period, now I got to continually work. Not necessarily. Some people go ahead and try a job. They work a month, it doesn't work out. Well, if it's over trial work period, which is 940 now, if it's over 940, Social Security is going to count a trial work period. If it's under 940, nothing lost. You haven't used a trial work period. And I encourage people to use their trial work periods because that's what they're for. Some people strategize them like they know, all right, I'm in school. I had one guy, he's going to school to be an IT professional. And so he had an internship. So he worked over the summer at this internship and he earned over trial work period amount. So Security had to count that income because he earned it. But then he went back to school in the fall, and then in the spring semester, and then after spring semester, he was offered a job. So he used 3 trial work period months, but when he was able to take this full-time job, he still had 6 more months of trial work period to use. So they'll count 9. And for someone who thinks, I'm going to start working, I know physically or mentally, all I can do is, part-time work, and I got this good job offer, it's just down the road, I'm going to make about $1,200 a month. You don't have to worry that you're using your trial work period because it's over $940 a month. However, their cash benefit will continue because of SGA. We'll talk more about this later. So they'll click through theirs consecutively. The extended period of eligibility always starts right after the next trial work period month ends. So like I said, you can use your trial work period within that 5-year window. So someone may have 2 that they tried up here, then they decide to go back to school, then maybe they used a couple more, or they got some training and something else worked, but that job didn't work. They tried a different job. So once they count 9, then Social Security will say, okay, now your EPE starts. That's the extended period of eligibility. And that extended period of eligibility is on a clock. Once you start EPE 1, the 36-month counts go. You can't save them or bank them. You're just in the extended period of eligibility. The good news about the extended period of eligibility is during EPE, if you are earning more than SGA, your cash benefits are only suspended. They're not terminated. In other words, they'll just stop them for the months that you're over SGA level. So you can continue to work, and then if something happens during that 3-year period and you're not able to work, you call Social Security and your cash benefits start the next month. In other words, you don't have to do a new application. You don't have to do anything. It's just like they're taking those cash benefits and they're setting them on the back burner because you don't need them right now. You're working over SGA. Okay. So after the trial work period, the CPE, this allows you time to really figure out if you're able to work. So that is a really important safety net. I think of it as like if you're learning to be a tightrope walker. So you can think of the trial work period as climbing the ladder or working your way towards success, and you're willing to give it your all. And now you're up there on the platform. Now you're hitting extended period of eligibility. So you're beginning to walk, and you're walking across the tightrope and everything looks good. Oops, you know, you had a little slip up. So, but there's this good extended period of eligibility net that's there to protect you. So you can climb out of the net and you can climb the ladder again and try again to see if you can work during that time. And so it's a really wonderful safety net. And I've already mentioned that it can't terminate during EPE, it's only suspended. And they normally don't use the unsuccessful work attempts or averaging during EPE because they're looking at your level of SGA. Again, that's substantial gainful activity. So if you're not performing at SGA at any time during that 36 months of EPE, you get your cash benefits and they continue indefinitely. So that person who's working a trial work period during, you know, they're earning $1,200 a month through their trial work period. Now they're in EPE and they're still earning $1,200 and they know that's all they're going to earn. They're not planning on working on any more. They get their $1,200 cash benefits and their full Title II benefit indefinitely because they're under SGA. And I think I've told you before too, if they're working above SGA, or say they started at it, you know, at under SGA, and then sometime during the period of those 36 months, they got a job offer, or they now double their hours, or they're working well over SGA, Social Security they'll suspend those benefits during those months, and then they can call, get it restarted the next month, and then their cash benefits will continue indefinitely again until they perform SGA. So one thing's important to note is that there's what's called succession or cessation month and grace period. So that's a total of 3 months. So anytime Social Security is making this SGA level decision, they're going to look at your period of time. Remember, are you able to maintain this SGA level work? How's it looking? And then Social Security will go back and say, okay, we think you started to do SGA level work here. But so we'll call this your cessation month, and you still get 2 months of benefits. So it helps with financial planning. So you know, okay, during trial work period, no matter what happens, I get my full SSDI benefit and my earnings. But now I'm in extended period of eligibility, I'm earning above SGA, I still get 3 months of benefits because of this cessation and grace period. So a person could have a full 12 months of benefits to help them plan for, we call it the cliff, because with SSDI or Title II benefits, that person, they get all of their cash benefit or none of it. So again, I think I've said this, the cash benefit would not stop for at least 12 months, the 9 trial work period months and 3 grace periods. That's a whole year safety net to financially prepare for what's coming up, okay? And again, you only get this trial work period and you only get cessation and grace once during your period of entitlement. So if you've used those work incentives already, you can't just go get another one. So you're working with someone who's receiving an SSDI benefit. You need to ask them, have you used any trial work periods in the past? And if they are unsure, you can ask them, they can ask to get what's called a benefits planning query or BPQY from Social Security, and that will tell them what Social Security has on record about their trial work period usage. Some people have used them, they didn't even know, or because Social Security has to do a work activity review, but you always want to make sure you know how many trial work period months a person has used so they can plan appropriately going forward. Okay, so you're this tightrope walker. Again, you're up on that line and you know you're out of EPE now, your extended period of eligibility. So that safety net is gone. But guess what? Underneath that is still yet another safety net. It's called expedited reinstatement. Expedited reinstatement, there's a whole nother 5 years after a beneficiary's has had an SGA determination and their benefits have been terminated. So remember, an EPE only suspended. After EPE, your benefits would be terminated. And you still got another safety net for 5 years to say, okay, I can still get my benefits back if something goes wrong. So what happens with EXR, they must be unable to perform SGA level work. So someone may have been plugging along really well and everything goes, but maybe there's a complication with their disability or with their health condition or something. And so you just tell Social Security, I want to apply for EXR, expedited reinstatement. Social Security will start 6 months of provisional payments. You don't automatically get 6 months. It just depends how many months you'll need. It's a maximum of 6 months. And then Social Security conducts a new medical review. This isn't the same kind of medical review that a person had to go through to get on initially. It's much less than that. They just look to see if you still have the same condition, if if you've had any other health concerns, and then they'll put you back on your benefits through expedited reinstatement. If you're found that you are no longer medically disabled, you don't have to pay back those provisional payments provided during the EXR, that redetermination. That's always good to know. All right, the other benefit that we're going to talk about is the extended Medicare. Healthcare coverage is super important. Most people who receive an SSDI cash benefit, it's important to know, and if you're on a specific list of compassionate allowances like kidney failure, you might get Medicare to start right away. Most people wait 2 years, 24 months to get Medicare coverage when they become entitled to an SSDI or Title II cash benefit. They have to wait 24 months. So when they get that Medicare, they really want to hang on to that. Now, if you're age 65, you get Medicare automatically just because you're age 65. But so with the extended period of Medicare coverage, as they're working their way through the trial work period, the extended period of eligibility, the good news is this extended period of Medicare coverage lasts 93 months. That's almost like 7 years and 9 months after the trial work period ends. So if the cash benefits are stopped after trial work period months are completed and the 3 months of cessation grace, you're suspended, You still got 93 months of Medicare continually. And Medicare has, or Social Security have what they have is called a Medicare wizard that can tell you exactly when that coverage starts and stops. So again, you can plan, but that's a long time. And say you were working along, but you weren't above SGA, you're in EPE somewhere and now found a job and you're working above SGA and everything's going good, it goes at least 72 months after that period. So that Medicare wizard can really help you figure out where you're at with the Medicare coverage and help you plan for long-term health care. All right, how do you get help with the ticket to work with Title II Social Security benefits and work? Again, you can call the Social Security's Ticket to Work helpline, and that'll put you into the right WIPA. Again, there's 2 WIPAs, and I'll talk about that in the next section and what WIPAs do. And I've had clients call me who are on the line, you know, like perhaps they're in Tennessee or they're in Ohio, because some of like the Office of Vocational Rehabilitation may serve people who are directly right across the line. And but our WIP is not allowed to serve them because it's not in our coverage area. So this ticket to work line can help them get to the right place. And then you have someone who's trained specifically for those state benefits as well as the federal benefits. So here's that good ticket to work number. So what is WIPA? It's that Work Incentive Planning and Assistance Program. And we provide individualized, in-depth, employment-focused benefits counseling and also work incentive plannings in all 50 states and territories. We're funded primarily by Social Security, and it's part of their whole national effort to improve employment outcomes for people with disability who receive a Social Security benefit, because many people feel it took so long for them to get their disability benefit, they're terrified in trying to work. But also it's important to recognize that sometimes after you've been on disability, you really want to get out of the house. You're tired of counting the spots on the ceiling. You feel that you can do something. So work is not only a financial component, even though that often is a big driver for people who receive a disability benefit, but also there's that social network that you acquire at work. It's also gives you a sense of purpose. So there's many reasons why a person who receives a disability benefit wants to go to work. So it was created as part of the Ticket to Work and Work Improvement Acts back in 1999. Currently, there's 83 agencies across the United States and the territories, and they're staffed by trained work incentive coordinators. We all are trained. And like I said before, this is all about work. WIPA is all about work. It's so if we have a person who calls and they just say, I need help, you know, with my benefits, I got a overpayment issue, I'm not sure why. We can help with that, but if they're not planning on going to work, we're all about work. That's what we're trying to help with. So one of the goals is to increase the number of Social Security disability beneficiaries who choose to work for pay and actually help them long term. So we don't only help initially with that first benefits analysis to help them say, okay, I understand what's going to happen. I know how it's going to happen, when it's going to happen, what I need to plan for, but we're there long term. So when a person reaches that 9th trial work period month, we're there to help along the way. When now they got to look at SGA determinations, are there any IRWEs? We're there to help along the way. They're working along and now they can't work. We can help put them in touch with some other agencies that might be able to help. So we provide this work incentive counseling, again, to increase capacity of their earnings over time and actually help with the financial benefits of working. We also look at some of the budgeting figures and things like that so that they can weigh that whole financial picture, and also reduce the dependence on disability benefits and other income support programs. I have beneficiaries who say, I know I need to keep my disability benefit. And I also have others who say, I just want to be done with all this and all this paperwork. I just want to work, like everybody else. I don't want to have to deal with all these other support programs. I appreciate it, but I really am done with it. So some of the myths, we don't try to force people off of disability benefits. All we do is provide accurate information so the individual can make a decision for them, you know, what makes the most sense for them and their family situation, their financial situation, their mental health, their emotional health, the whole picture. We provide the information, they can make good decisions. We don't protect beneficiaries from losing their benefits. Sometimes that will happen. Sometimes if they're receiving a Medicare savings program benefit or food stamp benefit or something like that, they're income driven. They may lose these benefits. We just provide the information so they can plan for that and what happens, you know, what to do when that happens. Again, we don't help beneficiaries maximize benefits. We're just providing the information and they got to do what's best for them. We will help you find resources if we see you are eligible for a benefit that you aren't receiving. So I've run across people who are getting Medicare and but they didn't know about a Medicare savings program that could help them pay for their Medicare premiums, possibly you know, their copays and deductibles. So I may say, here's a good resource for you. Or someone that is needing personal care services and they don't even know about it. I might say, here's a resource for you. Have you considered checking into that? Because that just is enabling a person to work, to utilize the tools available to help them gain financial independence, okay? Also, we do not do wage reporting or we do not manage benefits, nor are we a rep payee service. We will help a beneficiary learn how to communicate with Social Security. There are times we may call Social Security on behalf of an individual if we have signed release forms, like to discuss an overpayment, what happened, what's going on. We can kind of help do detective work, but we can't represent a beneficiary in that way. And we can teach you how to save your pay stubs, who you need to call, when you need to report, and those kind of things. We can help you put together those impairment related work expenses, you know, save your receipts. We can help you, teach you how you want to document them so Social Security understands what you're doing. Okay. We do currently provide most of our work using distant technology. Obviously with COVID, this is what everybody's doing, but even prior to COVID, we did a lot of our work remotely. If an individual needs in-person help, we'll do what we can. We do have offices around our catchment area in Murray, in Bowling Green, in Louisville, as well as we can meet at libraries. We have relationships with the OVR offices, with some of the housing authorities. I've met in, you know, some boardrooms and things that are made available to us to help us provide this in-depth benefits counseling. Again, we do not provide employment services or supports. So if a beneficiary calls and says, I need help getting a job, I heard you work with so-and-so at UPS. Well, we can't get them a job at UPS, but we can recommend employment networks or the Office of Voc Rehab or somebody else who can help them with that specific goal. And again, Social Security, we cannot help with a person applying for Social Security disability benefits. And we also cannot help in the appeals process. So if someone applied for disability benefits and they were denied, we can't help. We can, if a person was receiving disability benefits and now suddenly their benefits are terminated and then they don't have any idea why, we can help investigate that situation if, as the beneficiary is appealing it, but we can't represent them. We can't be present at the meeting or on the phone. But we can tell you the kind of paperwork that you might need and, you know, assist you in gathering these things, but we can't be there. What can we do? One of the important things that we do is verify the information. It's super important to know exactly what type of benefits the person is receiving. Like I said earlier throughout the presentation, SSI is capped at $794. We'll say someone is getting $760 $60 in cash benefits. Well, you don't know if that's SSDI or SSI. And have you seen through the presentation, there are different work incentives and different ways that that benefit's impacted. It could be all or nothing. So you need to get that information verified to make sure you're advising in the proper way. Again, get a work incentive counselor to help you out. Because definitely, and also other benefits, state benefits, housing benefits. I had a beneficiary recently who's living in an assisted living home now, and they're going to be transitioning out on their own. But we had to know what type of home this was, so we know how working is going to impact their staying in this home. Or if a person has waivers, if they have Michelle P, how is working going to impact this specific benefit? For many people, if they're receiving waivers, without that waiver support, they're not going to be able to work or continue, even, be ability to interact within their community without these supports. So you want to make sure how the benefits are impacting each of these benefits. I mean, the earnings are impacting each of these benefits. So you have to know exactly, are they getting Section 8? Are they just getting straight public housing? Are there any work incentives? Which housing authority are they working through? So those are questions that you ask and things that you want to know. And that's what CWICs do. We verify these things. And then also we take a lot of training so we really understand how paid employment is going to affect this. We know how DCBS is going to count income for that Medicare savings program, or is going to count income for another benefit that they might be receiving. So it's helpful to know that. And we also will teach them about the work incentives, those things that we've talked about today, and make a plan on when to use them. So, okay, now you're at this point with your trial work period. As you're working, begin to look for subsidies, begin to look for this. Or at this time, your case is closing with OVR. What do you want to do next? And so we can help them utilize the work incentives and plan a path to success. We can help beneficiaries. Again, we do not report to Social Security that a beneficiary is working, but we can help them say, gather your pay stubs, or go get a payroll report from your HR manager at work. There's ways that we can help them gather and report. And it's important to note, like with the Title II disability benefit, someone may get vacation pay or sick pay. Well, Social Security is not going to count that because it's not earned. Remember, it has to be earned income for a Title II beneficiary. Now, it will count for SSI. So they need to know that. So we can, we teach them here, mark that, make sure Social Security sees that so they don't count that, so that they can manage their benefits long-term and manage over time. We can look at healthcare options, or we'll refer you to the SHIP line, the state health insurance, so you can find the best healthcare options for you, because as people are working, they may have their Medicaid, they may become eligible for Medicare. They may also have employer-sponsored health insurance. Like UPS will offer health insurance to their employers, and it may be a better deal than what they're currently receiving. So we can look at those options and let them know what needs to be done. Again, we can help resolve some benefit issues like that, overpayment issues, or one of the things like someone who is receiving an SSI cash benefit, but it's reduced, and now they move out on their own. They're no longer living with their parents, and that SSI cash benefit hasn't gone up to reflect that now they're out there on their own. So we can help work with Social Security to solve some of these benefit problems. And one of the things I always tell my clients too is you want to make sure you and Social Security are on the same page, because Social Security may have one thing about your benefits, but maybe they don't have all your work history, or they're counting something as income that's not really income. And so we can help make sure that you and Social Security stay on the same page. To become a CWIC, we went through a level 5 security check. That means the FBI really shows up in your little hometown and talks to your neighbors. They do an extensive background check, because we do work with people's personal, private information. There is a two-part training that we have to pass in order to achieve certification, and it takes about a year to go through the initial training and then to complete the certification process. And then also we have to take at least 18 credit hours a year to maintain our certification. And all that is done through Virginia Commonwealth's Training and Data Center. They're the ones that hold the contract with Social Security to provide this training. And they also provide technical assistance. So who is eligible for Social Security? So the person must be receiving a disability benefit, whether SSI, CDB, SSI, any of these. They have to be at least age 14 and yet not full retirement age. And so any of those, particularly those younger ones who are 14, and Social Security tells us specifically how we will provide services to beneficiaries. People who have jobs are automatically served first. We try to work as quickly as possible because they already have a job, or if they got a job offer on the table. So ideally, it's best to refer a person earlier in the process so they have all the information before they get their job. But we'll work at a steady pace with all of our clients who need the individualized attention. But those who have jobs, those are the quick ones. And also youth who are age 14, because often they're just in this decision stage. And we find through research that if they're not expected to work, it's unlikely that they will choose to work as they age when they turn 18 and when they go past that. So the more that a youth is encouraged to work, the better chance they have of long-term success through their lives of working and holding down a job. And I think we've already talked about these priority groups. We've talked about transition age youth. And again, that's even if they're in the early stages of just contemplating. If you want to make a referral to our WIPA, if the client is already working with an OVR counselor, that's Office of Voc Rehab, you can ask them to make a referral for you. You can say, I really would like a benefits analysis, and they can do that. There's a simple process set up for them to do that. If you're working with what's called an employment network or another community partner, they can also make a referral for you. You can call yourself. You can self-refer and just say, I'm interested in a benefits analysis. I'm receiving disability benefits. I'm thinking about going to work, and I want help. I want resources. I want to know everything that you can teach me, and we will be glad to contact him. And again, I've said, mentioned the Ticket to Work line a couple of times. If you call the Ticket to Work line, then a CWIC will call you, usually within 2 days of you calling the Ticket to Work line. So important referral tips, be sure to refer eligible beneficiaries because it's frustrating. And that's one thing as CWICs, we go through and check our referral sources. So if we're saying, call this employment network or call this Office of Voc Rehab, we want to make sure that the numbers are accurate. Or if we're referring them for housing assistance, I make sure that I'm giving them the right number, because who wants to call this number only to be told that it's wrong or it's the wrong number and you go from here to here, or that we can't help them. We'll be glad to refer them to a source that can, but if you find someone who's receiving a disability benefit, age 14 to full retirement age, send them our way. Again, refer them before employment, because the more information they have, the better chance of long-term success. And help teach them about beneficiaries, what services the WIPA provides. One of the important things to do is tell them who we are and that we're going to be calling them. We've had beneficiaries who someone refers to us and then we call them and they're like, I've never heard of you. And in this day and age of scams, people have a right to be cautious. So we say, be sure and tell them that Donna's going to be calling them, and just in a couple days, so they know what to expect. And we go through the whole process. And if you're in doubt if the beneficiary is eligible, you can refer them to the Ticket to Work helpline. You know, that's a secure line and they can help. You know, if you're not in a relationship with the client, that you can ask some of these probing questions, you can just say, hey, why don't you call the Ticket to Work line and see what information they might have for you. Here's the Ticket to Work information. They do provide general information and again, make referrals, and they let us know who we need to call right away. And again, we call them within 2 days, 2 business days. Again, share the good work about WIPA and also how important it is that a person can work and receive their disability benefit, that they're not mutually exclusive, and help spread the positive message that, you know, helps overcome these fears about working. It's possible to work even full time and keep your Medicaid and Medicare. It's also possible to work and come out ahead. Many people are so surprised when we sit down and look at the snapshot or the financial portion about how much better off they'll actually be, even if they let go of their food stamps or they let go of their Medicare savings program, how much better off they actually are in the long run. So, and again, the safety net underneath is you can get your benefits back if you lose them due to employment. So that's the end. Does anybody have any questions? I know we whipped through this pretty quickly.